Universal healthcare. Human beings do not get to pick and choose when they get sick and need medical treatment. They do not get to choose when they come down with the flu or when their child falls off his or her bike and breaks their leg. Taking a trip to an emergency clinic is a stressful and scary situation, as well as even a common doctor's appointment. Most humans do not contain all the knowledge to know what is wrong with our bodies when we are sick and are unaware of how to solve the situation. Therefore, we go to a medical professional to seek assistance. Illness and injuries are things out of our control. It is not something we ask for. Being forced to pay for such a thing we do not wish for is absurd and against basic human rights. Universal health care should be available for every man, woman, and child throughout the world, no matter your age, race, gender, or social status. As of 2022, the World Health Organization, or WHO, defines universal health care to be an assurance that, quote, all people have access to health services they need, when and where they need them, without financial hardship, end quote. According to the same source, about half of the people in the world do not receive the healthcare they need, and approximately 100 million people each year are pushed to extreme poverty due to out-of-pocket spending on healthcare. In the United States, we have what we call a mixed system. This consists of the government-associated Medicare, which coexists with privately financed market coverage. Many Americans also pay out-of-pocket for their healthcare bills in America. According to the Global Residence Index as of 2021, 43 countries offer free or universal healthcare to at least 90% of their citizens. This means that in only 43 countries can you comfortably be seen by a doctor without worrying about the large, looming medical bill that will come from your visit. Included in these countries are France, Italy, and Norway, which have some of the highest rated healthcare systems in the world. The United States is not considered to be one of these 43 countries. Universal healthcare is something that should not be up for debate. 50% of the entire population in the world do not receive the healthcare that they need when sick or ill. Although it may sound simple and straightforward, providing universal healthcare to all is not that easy. In many third world countries, the technology needed for universal healthcare is not available to them. Unfortunately, it is not just as easy as building a state-of-the-art hospital in the middle of the town either. Many of the resources needed to support such a facility are not available at this time to those people. Luckily, there are still ways to maximize what healthcare is already established in these areas. With financial support, we can build more facilities and upgrade the current ones to give more safe opportunities to those who need healthcare. There's also nothing stopping these countries from making healthcare universal in terms of how much it costs to be seen. Although the technology may not be what we have here in America, there's still the opportunity to get free healthcare or healthcare that does not force a patient into extreme debt. Although universal healthcare may sound like common sense and a necessary human right, unfortunately, not everyone sees eye to eye on this topic. Many believe the cons of universal healthcare outweigh the pros. They claim that the increased wait times, potential rise in taxes, and potential to worsen the doctor shortage are reasons to avoid universal healthcare. Universal Healthcare Pros and Cons 2022. Considering the unfortunate likelihood that universal healthcare would most likely send Americans further into debt, many people believe universal healthcare is not an attainable possibility. Although many of those people who feel this way are the same people who are a part of the 50% of the world who are able to seek medical attention without the looming debt. There is no denying that universal healthcare is a topic that is not always agreed upon. A portion of the wealthiest people in the world are not focused on the entire world, but rather just on the well-being of themselves. These types of people make it more difficult to move towards universal healthcare and moving in the direction of making decisions for the betterment of the world health. The choice to move towards universal healthcare may mean you have to pay a little more in taxes or wait an extra week to be seen by a specialist, but it also means that children do not die of poverty or do not become terminally ill because their parents cannot afford for them to be seen by a doctor. Although we are nowhere close to where we want to be, progress is being made in the right direction. There is current action being taken today that is moving in the direction of universal healthcare. Sustainable Development Goals, or SDGs, are 17 goals set into motion by the United Nations in 2015. The third goal of the 17 focuses on good health and well-being. One of the key points of the third goal is to, quote, achieve universal health coverage, including financial risk protection, effective, quality, and affordable essential medicines and vaccines for all. United Nations Sustainable Development 2022. Universal healthcare is not something that should even be up for debate. It amazes me that there are human beings out there who are not in favor of providing every human being with necessary medical treatment needed to survive, simply because it would be a slight inconvenience to them. The only thing stopping us from reaching universal healthcare is ourselves. We are consciously making the decision to live a better life than others simply because we do not want to sacrifice a small portion of what we have for the greater good. As boys, girls, children, adults, and people of all ages, we must be better.